Thank you so much.
Thank you.
Our next speaker of the day is Dr. Doris George Johanan. Sir is Assistant Professor in the Department of Anatomy at Government Medical College, Trivandrum, Kerala. Sir has completed his MBBS and MD Anatomy from the Kerala University of Health Sciences. Sir has 10 years of teaching experience in anatomy. Sir has 14 journal articles in indexed journals. Sir research area of interest is neuroanatomy, medical education and use of technology in medical education. Received a travel grant award for international travel support by the Science and Engineering Research Board, Government India, to attend the 19th annual course, Neuroradiology and Functional Neuroanatomy at University College of London. Sir is the invited speaker in International Brain Research Organization, Asia Pacific Regional Conference, Neuroscience School 2019 at SCTIMST, and member of American Association of Anatomy, Anatomical Society of India, Kerala chapter, and Indian Medical Association and Society of Clinical Anatomists. We are indeed privileged to have you with us, sir. Before listening to Dr. Doris, I'm highly delighted to introduce our first panelist for this session, Dr. D.R. Singh, sir. Sir is an emeritus professor, great author, and outstanding researcher, and a diligent teacher. Sir has done his MBBS from King George Medical College, Lucknow, and PhD in anatomy from Aligarh Muslim University under the guidance of Dr. Mehdi Hassan, sir. Sir has also been a contributor forwards the authorship in self-authored textbook, and the second edition of his recent book have been translated into Turkish language. He has been awarded by many awards, to name a few: Dr. Hariom Ashram Alembic Research Award, Dr. Dharam Narayan Memorial Award. We are feeling honored to have you with us, sir, today. Our next panelist for this session is Dr. Sneha Agarwal, ma'am. Ma'am is presently working at Lady Hardinge Medical College, New Delhi as director, professor, and head of the Department of Anatomy. She holds a keen interest in teaching and research. Having more than 70 publications across national and international journals, she has been a subject expert at various international conferences. We are fortunate to have you with us, ma'am. Our next panelist for this session is Dr. Hitant Vora, ma'am. Ma'am is the professor and head Department of Anatomy at DMC, Ludhiana. Ma'am has many publications to her credit. She is also the faculty reviewer of Snell's Clinical Anatomy, South Asian edition, and also on the National Advisory Board for I.B. Singh Textbook of Anatomy and Human Embryology. We are honored to have you with us, ma'am. Our next panelist is Dr. P. Vatsala Swami, ma'am. Ma'am is the director at D.Y. Patil Medical College, Pune, India. Ma'am has a teaching experience in the subject of anatomy of almost 49 years and more than 60 publications in both national and international journals. Ma'am has also contributed chapters in the books of medical education. And ma'am is the member of International Forum of Teachers and presented a paper in UNESCO chair and also received the Best Teacher Award in 2012. And she was conferred Best Administrator Republic Day Achievers Award by Integrated Intelligent Research. Ma'am is the best director of, has also received the Best Director of Academics Award. And she is rendering voluntary service as a trustee and treasurer of Care India Medical Society, an NGO that takes care of terminally ill cancer patients. We are feeling privileged to have you with us, ma'am. Our moderator for this session is Dr. Gaurav Agnihotri, sir. Currently, he happens to be the associate professor in the Government Medical College, Amritsar. He has very good professional capabilities along with teaching both undergraduate and postgraduates, a working knowledge of computers and software, and with holding the working knowledge of histopathological techniques and setting up of the histology labs. He has been the reviewer to 8 journal manuscripts, has also been the guest lecturer and invited talking in multiple areas. In total, he holds 62 of his publications. He has also been the life member of Anatomical Society of India. We are very privileged to have you with us, sir. Now, I request Dr. Johanan to start his talk. Sir, would you like to go live? Dr. Johanan, sir.
I'm not allowed to
Okay.
Yeah. Can you hear me? Can you hear me now?
Yes,
yeah.
yes.
Yeah. I have. Can you play that recorded video? Because.
Okay, sir.
Yeah. Good afternoon, ladies and gentlemen. At the outset, let me thank the organizers of the International Workshop of Anatomy, especially Dr. Jain sir, for inviting me to talk in this prestigious conference. Let me introduce myself. I am Dr. Doris. I represent Government Medical College Thiruvananthapuram, the Department of Anatomy, which is located in Kerala state in India. I've been asked to speak about the role of hand gestures in learning anatomy, especially learning spatial anatomy, from my experience of using air anatomy. Now, many of my audience may be wondering, what is air anatomy? Air anatomy is a term that we have devised for a method of teaching anatomy, where we can teach anatomy in the air. Okay. It means to give a contrast, to give a perspective, I will say, we can teach anatomy with textbooks, with notes. We can teach with pictures, labeled pictures, wonderful pictures, with models. But in spite of, we can use a lot of technology, okay? Virtual reality is there, augmented reality is there. But along with that, we also are advocates of using hand gesture based methods of teaching and learning and understanding anatomy, and we believe that it is a very good method. So that is a term called air anatomy, and I'll be detailing on that in this talk. So I'll be talking in this format. The outline of my talk will be, first I'll be talking about anatomy learning in general, then I'll be speaking about the specific theories in general learning and in spatial learning. These are educational theories. Now, the next I'd like to talk about the role of gestures in human communication and in learning. Okay. And is gesture, hand gesture, a very good method to teach anatomy? So we'll be discussing on that. And then I'll go to the topic called air anatomy, the one that we have devised, and what is the motivation behind it. What is the experiment that we did, and this experiment results were actually published in the prestigious journal Anatomical Sciences Education, the Journal of American Association of Anatomy, in this year, early this year. And then I'll conclude by telling some take-home points, or the points that I have learned, which may be useful for all the members of the audience. Okay. So what are the peculiarities of anatomy learning? As you know, anatomy learning is extremely important for any medical graduate or any paramedical courses. Anything that deals with the human body, anatomy is extremely important. But unfortunately, it is extremely challenging too. Now, what are the reasons for these challenges? One is obviously the subject factor. Anatomy has a sheer volume. The content that has to be learned and taught is extremely big. Okay, so many of the students find it so hard in the initial first years. They find it so, it is so massive to learn and understand and imbibe. And another aspect is the introduction of new terms. They have to use these terms throughout their medical career. That is a reason why we are introducing all these terms in the first year itself. But students are often overwhelmed by the so many new terms that they learn. And another aspect is the spatial complexity. So spatial complexity is something that really adds up into the complexity of anatomy, and we have to give some specific attention to make the spatial complexity simpler for the students, so that the volume and the new terms itself, they are itself big challenges for the students, but this is something that we can reduce. Now, the next thing is the student factor. This is the demographic generations in the last 2 centuries. And now, currently, the generations that we teach will most probably be the Zoomers or the Generation Z. Okay, if you look at the Generation Z, each of these generations are based on, the socio-cultural factors. As example, if we look at the silent generation, they were exposed to the world wars. Okay, and if you look at the the millennials. Millennials were they just started in their childhood, they started to experience internet. But if you look at the generation Z, those who were born from 1997 later on, they were exposed to modern technology, to internet in most of their time periods. If we go to the next generation, that means the ones that are born from 2010 onwards, they were born in the time when they have the current technological advancements. So as the generation advances, our teaching strategies should also change. Most probably the teachers, we all may be in the millennial generation or in the generation X or maybe in the baby boomers, but these generations need to adapt the style into one which the Zoomers will find more palatable. Now, what are the tools that you use to visualize anatomy? If you take a poll, it will be mostly text or words or notes, that means written or spoken words. We will be using pictures a lot, then videos, dissection, obviously, dissection is the mainstay in many medical schools. Models we will use, and as we can see, as we go towards the right, you can see use of imaging. Okay, many schools are now incorporating imaging into understanding anatomy, and also use of newer technologies like virtual reality, augmented reality. You might have heard about Anatomatch, where a complete human cadaver is in a digital table, and you can go through all the layers, you can go through all the planes. So everything is possible now with the technological advancements, and these are all useful for the Generation Z students. There is no doubt on it. But the point is, the point that we thought about is, are all this accessible? We are teaching in India, and I've not yet seen an Anatomatch table. I've not seen virtual reality or augmented reality being taught in student communities in my setup, in my educational setup. Imaging is also not actually being used within our setup, except maybe X-rays and CT MRI films are being used, but an actual a station where they can manipulate them to learn anatomy is not yet being done. So technology is the ideal way to introduce spatial concepts to anatomy teaching, but the accessibility is still far reached in many places in the world. So we need other methods to teach anatomy, and all these methods are proven. They are all, many studies have proven their effectiveness. Now, what are the theories in general learning and in spatial learning? The theories that I want you to give attention is, one is called the dual coding theory, which is in the 1970s and 80s. It says that you have verbal stimuli and you also have non-verbal stimuli, and both of them are important to create a mental representation. So not only words, but also non-verbal communications are important. This is extremely important from a medical educator's point of view. You need to understand that it's not only the words that is important, but many other things form a big content of what you teach, of the way you teach, of the manner in which you teach is much more important, more than the words that you say. This is exactly the one that was that is hinted in a very good article that I suggest all medical educators should learn. It's a very small article, 12 tips for effective body language for medical educators by Hale et al. It was published in Medical Teacher in 2017. It says a lot of small subtle things in which body gestures, stance, even the way you stand, even the way you look, the way you can incorporate humor into your dialogue. So everything has a lot of meaning in the effective way to communicate to students. And in this one sentence that caught my attention was the 7-38-55 rule, which was actually developed in 1970s. And it says that of your communication, only 7% is actually from the words. 38% is from the tone of your voice, from the tone, from the prosody of your voice. And 55% is from the body language. So can you see, it's almost 93%, 80 to 90% of what you communicate is not from the words, is from the body language or from your tone. So we have to pay more attention on these aspects. Though they look subtle, they are actually much more important in what the student actually gains from a teacher. This is another very important theory developed by mainly by Sweller. Took this from Sweller's paper in 2010. it is called cognitive load theory, and there are three components of cognitive load: intrinsic load, extrinsic load, and germane load. Okay, what is intrinsic load? Intrinsic load is intrinsic to the content that we are teaching, but that is mostly static. It is mostly independent. Okay, independent of the instructor or the mode of instruction, because it is mainly dependent on the learner's previous knowledge and also the complexity of the task. And the extrinsic load is the demands imposed on the learner's brain, on the cognitive ability by the instructional mode. Okay, and germane load is the one that will help the student to organize their learning. Okay, so an ideal method of teaching, it will not modify the intrinsic load, but it will reduce the extrinsic load and it will increase the germane load. So any good method, any optimized method of teaching should reduce EL or extrinsic load and increase the GL or germane load. This is another interesting theory that every educator should know. That is a multiple intelligence theory. That means your student is not the same as you. My student is not the same as me. Okay, these are the different 8 types of intelligence styles that a student can possess. One is visuospatial, bodily kinesthetic intelligence, logical mathematical intelligence, natural intelligence, linguistic intelligence, musical, interpersonal, intrapersonal. These are the various domains of intelligence, and each person will have all those 8 domains, but in various proportions. Some people may have a linguistic ability more, so in those persons it may be more useful for them to hear lectures. Some people may be more involved in visuospatial. For them, they need visually presented content. Some people may have kinesthetic intelligence and they need to manipulate objects. They may need to touch, and a dissection may be good for them, or creating a model may be good for them. So all this, the priorities of the learner actually depends on their own combinations of this intelligence. This is another popular model called the WARC model. You might have learned about this. This is called visual, auditory, reading and writing, and kinesthetic. It is a much more simpler method. You can learn about this from warclearn.com. And this also says that you have a preference or a combination. There is no, usually you don't have a single modality. Usually people are multi-modality, learned by multi-modal methods. Okay, so these things should also be in the mind of educators when they teach. Another variable is the spatial ability of student. Okay, so this is a mental rotation test that is developed by Peters from the University of Guelph. I actually contacted him for my study. I've gratefully gave me this mental rotation models. Mental rotation models means you can understand from this 2D picture that this is actually look like a 3-dimensional object. It is a 2-dimensional representation of a 3-dimensional object, and it can be rotated to several models, and students, if they can mentally rotate that is called that is one of the measures how you can measure that person's spatial ability. And it has been proven in many studies that a student's spatial understanding in anatomy is actually dependent on that student's spatial abilities. Okay, so these are the different theories. If you know these theories, you can understand how much valuable gestures can be when we teach. Okay, so when we talk, okay, when people talk, they gesture. Okay, you can see 3 pictures here. One is the famous Martin Luther King Jr. delivering an inspirational speech. The next is an orchestra conductor. The next is a mime artist. And you can see how much even their face, even their hands are providing communication to us. Even when we look at Martin Luther King Jr.'s picture with his hands pointing and his face shouting at something, we know the emphasis that he is giving on whatever he is speaking. When we look at this composer, looking at his eyes, looking at his hands, we can understand that he's showing the passion of that specific movement of his orchestra. Okay, it may be he may be directing the orchestra to play it more louder. Okay, with the intensity of that music is shown in his eyes. Okay, everything is there in his body language. And if you look into a mime is one of the beautiful artistic methods in which kind of entire story can be told just by facial and hand gestures. So all these are just telling us how much powerful the gesture, the aspect of gesture is in human communication. This is, you may know this person, this is Richard Feynman. Feynman is a very famous theoretical physicist, and Feynman's lectures are extremely attractive, very popular, because he usually simplifies topics. Okay, one of his principles of teaching is that you need to simplify things. Okay, so we being anatomy teachers, knowing that anatomy is one of the complex subjects, we have to devise ways in which it can be made more simpler. Okay, so one of the very attractive quotes that Feynman said was this: if you want to learn a new or seemingly complex concept, try figuring out how you would teach it to a child in simple terms. Okay, he's a theoretical physicist teacher. We know how complex physics is, and you can see how he's using his hands in all these lectures, how he's using his hands and his body language to convey the concepts that he thinks are highly complex. So being anatomy teachers, we can use hand gestures just to convey the spatial component, not only to convey the spatial component, but also to convey the passion, also to convey the importance. Everything we can do by incorporating hand gestures into it. Now this is a very interesting aspect, the gestural theory of language. You should always think that language is not something that is spoken alone. It is not something that is written alone. It is also something that is gestured. It is also something that we can speak with our eyes. Okay, so if you look at this picture, this shows a four-legged, an unevolved monkey to an ape, and then they evolved into a modern human. You can see how the hands are getting free. Okay, hands were used for locomotion in the four-legged monkey, but in the biped modern human, the hands are free. And we know that in evolution it is said that the freedom of hands was extremely important, because the freedom of hands enabled us to use it for tools. Okay, not for locomotion, use it for tool making and also for gesturing. Gesturing was important. Probably gestures developed even before vocalization apparatus. That means even before rudimentary vocalizations that is found in lower animals, even before the development of the modern language, okay, or the dialects even of the Homo sapiens that in the 70,000 or 50,000 years before, the languages that they developed, even at that time, before the origin of those languages, hand gestures may have been evolved. Okay, so that is called the gestural origin of language. And this is again proven by the fact that even if you look at a child, how the child communicates initially is all through gestures. You can look at this picture. I've taken these screenshots from this YouTube channel, in which they have actually shown that you have to interact with the child through gestures and communication to improve that child's language. You can look at this picture and intuitively you can understand that that child is asking that parent to lift him up. Okay, and this girl is waving her hands, probably bye or hi. And this boy is definitely asking for something, and he is getting that in the next shot. He's getting that biscuit and he's very happy about it. So you can see how before the origin of language, before the child begins to speak, the child can use gestures to communicate. That is the exact thing that Feynman said. If you want to teach something that is complex, make it as simple as a child will understand it. So using gestures is one of the very easy methods how you can simplify the concept that is extremely complex, that you perceive as extremely complex, into simpler terms, freeing your mind to make room for creating more room for new terms and more content that you have to learn, more volume. Okay, so all those them can be more easily accommodated if you just simplify the spatial aspects. Now this is also something that you need to know. There is two types of knowledge. One is called primary and the next is called secondary knowledge. This is the classification. Primary knowledge is easy and unconscious. Okay, you can easily and unconsciously learn something that is primary knowledge, but you need a conscious effort when you learn something that is biologically secondary knowledge. Okay, there is intrinsic motivation when you learn something that is biologically primary, but you need extrinsic motivation when you learn something that is biologically secondary. Limited instruction is required for something that is primary, and explicit instruction is required for something that is secondary. Gesture is an example of primary knowledge, and written words and is an example of secondary knowledge. And this is extremely clear that as gestures you can easily and unconsciously learn, and written words you need a conscious effort to learn. That's why we need an explicit instruction. You need schools to learn written words, but to teach gestures it is not needed. Okay, that is inherently present in humans. This is explicitly evident. Suppose you go to a place where you don't know that language. Suppose you come to India, suppose you come to Kerala and you don't know Malayalam and you want to drink some water, you can just say, okay, and that means to irrespective of cultural or language barriers, it means that you need water, you are thirsty. So that is the importance of gestures. So this is a very old account from Plato's Criticalist. Criticalist means it is a Greek classic that is on the basis of origin of words. This is actually a dialogue between the famous Socrates and Hermogenes, in which Socrates is asking, suppose that we had no voice or tongue and wanted to communicate with one another, should we not, like the deaf and dumb, make signs with hands and head and the rest of the body? Then Hermogenes replies, there would be no choice, Socrates. And Socrates says, we should imitate the nature of things. The elevation of our hands to heaven would mean lightness and upwardness. Heaviness and downwardness would be expressed by letting them drop to the ground. The running of a horse or any other animal would be expressed by the most nearly similar gestures of our own frame. So it just shows that how much a gesture itself can communicate to one another in human cultures. Now these are the different types of co-speech gestures. One is called deictic gestures. I'll be focusing mostly on these two gestures. One is called deictic gesture. Deictic gesture means pointing gesture. When I say that, okay, this is a deictic gesture, it just means, okay, I'm pointing out. Okay, and suppose I want to say that, okay, I can also trace. I can say that, okay, this line is the line that I need to. So that is also pointing, and I'm also tracing that, or I'm tracing a rectangle like this. So they are all called deictic. Okay. And the next is called iconic gestures. Iconic gestures means you create the shape or the attribute of that structure. For example, in this picture, it is shown a tent, and a tent is shown by an iconic gesture. You can show a sphere, you can show a cube. Okay, everything can be shown with iconic gestures. So these two, if you just combine, if you just show a cube like this, and if you show a deictic gesture to point on one face, okay, that is how you can create a cube just in front of you and manipulate it to create different aspects of it and show relationships. This is how you can teach anatomy using air anatomy techniques. Okay. The next is there are also other co-speech gestures called metaphoric gestures. For example, you use a V for victory, or you use like this for victory. They are all called metaphoric gestures. And the next is beat gestures. Beat gestures just means according to the prosody or the rhythm or the of your language, you just move your hands like this. They are called beat gestures. It doesn't mean anything. There is no semantic communication, but they are part of the rhythm of our speech. These two are not so important in the gestures that we consider. We will be considering only deictic gestures and iconic gestures, and usually they will be accompanied with speech, with depiction, and along with that, we will manipulate them. We will also use gaze in order to understand these things. Okay, gaze is also, because when we look at a structure, when we look that this is a point, this is a posterior surface, and this is an anterior surface, and if gaze accompanies that will add to the spatial understanding of the viewers. Okay, so these are the points that we can use to augment the way of using gestures. Now, why is gestures used in anatomy? It will give visuospatial memory, and it will also provide motor memory because we are using our hands, and using our hands especially increases motor memory within our brain, and that is also one aspect of, they are all hidden memories. We don't even know that we are remembering these. Next is, it is a part of a primary knowledge. It is classified under primary knowledge. It will improve, it will moderate the cognitive loads in such a way that your cognitive loads will be more free. It will help to understand an idea or concept better. That can free up the working memory space. There is more room for interactivity. The teacher can interact with the space, and also the students can also interact. When I teach using air anatomy in my table, I usually ask students to join with me. When I create a model like this in the air, I ask students to point out which is the lateral surface. Tell me where is the facial nerve in the middle ear cube. Okay, so the students can also interact with them. And we can actually enliven the topic. And there is also economic advantage. That is extremely important in my perspective, because you don't need anything. You just need probably pictures or models. If you have, you can augment that. But other than that, there is no technology needed. Nothing is needed. But you can easily, it is more accessible, and so it is more advantageous for any educational setup. So air anatomy, how did we decide to study on it? Okay, what motivated us? After a couple of years after I taught, I took a student evaluation, and the question I asked was, state a few qualities that you appreciate in my teaching methods. It was an open-ended question, and these were some of the responses of students. One is, the 3-dimension you create in the air is simply awesome. We could imagine the model there itself, even without seeing the real picture. The 3D technique with your hand gestures to teach things like larynx. It is very useful and interesting, and you should really try to improve it. This is one of the best methods to teach anatomy for sure. 3D modeling with hands. Now, the point I want to stress here is that these were actually guiding lights for me from the students. I just gave them an open question, what did you like in my teaching the most? This is something we often ask our students. But when they replied that like this, then I understood that, okay, I was actually using this method, and that is actually much more effective for the students than what I imagined. Okay, I didn't actually know that this was something really useful for students, but they pointed to me that this was actually helping them out really well. And later on, as I focused and learned about it more, I really understood it. I teach a wide range of students, not only first years. I even had taken lectures to neurology fellows, and they also say that when I teach in the air like this, it makes it much more clearer. The spatial concept is much more clearer. So the point here I want to stress is that sometimes students can direct you, okay, which is best for them. Okay. So I want to introduce before you the team, the air anatomy team, this wonderful team that has helped me to realize our research and explore this concept of using hand gestures to teach anatomy. Let me just name these wonderful people. This is Mr. Shantanu, and this is Rakesh. They two are final year students now. This is Dr. Amog. He is now working in the Tata Institute. He is after medicine. He went for a research. He's interested in neuroscience. He is a person who did most of the study design. And this is Dr. Ashwati. She's studied from CMC Vellore. And this is my postgraduate student, Dr. Nathan. And actually, when I got this idea from this feedbacks, I actually discussed first with Dr. Ashwati, and we both then formed up this team of wonderful persons. And I should say that a team is the most important factor in a research. If you are doing an educational research, especially if you have a wonderful team, your job is half done or more than half done, because that you can see how vibrant this team was, even from this picture, I feel. All of them has provided so much ideas that we could use to improve our research. And the first step that we did was we created small videos, and they had inspired me to make a small YouTube channel. Okay, this is called Air Anatomy. You can search for it in the YouTube. I have added small videos using hand gestures to teach diverse subjects from neuroanatomy, histology, gross anatomy, embryology. Okay, many different diverse short topics has been taught using this. Okay, and finally we did a research study, a randomized control trial, and this could be published in Anatomical Sciences Education, that is the journal of the American Association of Anatomy, and this was funded by our Director of Medical Education, and we are really happy that our research came out well with very good results. Now, these are some examples how we teach it. Suppose you want to teach that on the heart, on the right side you have the right atrium, here you have the right ventricle, and here you have the left ventricle in a heart. It is a little bit difficult in the initial aspect for the student to understand it. So what we usually do is we can put the simple heart, or what you call the Valentine heart. This is not the anatomical heart, but if we make students imagine this, and if I manipulate my hands, you can see how I manipulated the left hand and the right hand to make it in such an aspect, and then I can make the students understand that the right atrium is here, the right ventricle is here, and this will be the left ventricle, and behind you will have the left atrium. This is the precise orientation of the heart chambers. And this is also useful even if you are doing an echocardiogram, you can understand that the four-chambered view, an apical view of the four-chambered heart will be like this. The right atrium will be here, right ventricle will be here. This will be the place where you have the left ventricle, and this will be the left atrium. This will be the location of the cardiac apex. The cardiac base will be containing the left atrium. So all these concepts becomes clearer when you start to use hand gestures. This is another, all these pictures are within that article itself. I am now showing the midline in the human body, and suppose this is the right thalamus. The rounded end I am showing with the right hand. The pointed end I am showing with the left hand. And I am now using a hand for a coronal cut. So if this is the midline, this is the pointed end, and this is the rounded end, and I am taking a coronal cut in the right thalamus. The left thalamus will be like this. So everything I can create with my hands. Just I need my imagination and my hands to create the illusion in front of my students. Now this is again creating the axillary walls. I am creating the upper thoracic wall, the upper end of humerus, the pectoralis major and the pectoralis minor insertion. All of these are some of the examples that are shown within that article itself. Now I want to add more importance to what is the potential of using this. This is something that we often teach to our students, the internal capsule structure. We know that it is L-shaped. Okay, an L-shaped structure containing an anterior limb, a genu and a posterior limb. The lentiform nucleus is on the lateral aspect. On the medial aspect you have the caudate head and the thalamus. Okay, and we also say that within the internal capsule you have different types of fibers. But it's often very difficult to make students understand how these fibers are directed. Okay, how you have various types of fiber. You have frontopontine, you have parieto-pontine, you have occipito-pontine, you have corticospinal fibers, you have thalamic radiations. All of them becomes complex. But if I add it using gestures, I make students think like, if this is the thalamus, from the thalamus you have anterior thalamic radiation that goes like this. Okay, posterior thalamic radiation that goes like this. Okay, so that is again in the 2D plane itself. Instead of that, I am taking the thalamus out, I am making it here. This is my right thalamus and this is the midline. I will say that this is the anterior thalamic radiation. This will be the posterior thalamic radiation. This will be the superior thalamic radiation, and this will be the inferior thalamic radiation to the temporal lobe, to the parietal lobe, to the occipital lobe, and to the frontal lobe. Okay, that creates a spatial understanding for the student. And then the student understands that the internal capsule is a home. It is harboring different types of fibers, and thalamic radiations are part of it. Okay, it also contains corticospinal fibers from the entire precentral gyrus, and from a little bit of premotor cortices, and from the postcentral gyrus you have fibers converging from the entire three-dimensional wide area of the brain. They converge towards the internal capsule posterior limb. Okay, they converge towards the internal capsule posterior limb over here. So I can make that concept much more clearer if I bring this from this 2D perspective in the screen to a three-dimensional perspective using hand gestures. Okay, so that will create an illusionary image. Now, this will also add more and more understanding if we use more technology based. This is diffusion tensor imaging and axial cut. This is stratigraphy, where you can see the entire corticospinal fibers converging to the internal capsule. Here also you can see in this diffusion weighted the diffusion tensor imaging picture, you can see that the anterior limb of the internal capsule is green in color, showing the fiber direction is anterior. That is the one that I have shown now. Now the posterior limb fibers are directed downwards. That is the one that is shown with purple color. So the complex understanding of different colors in this diffusion tensor imaging, which is usually taught in an advanced neuroradiology course, becomes very simple when we use an anatomy technique, when we teach it with hand gestures. That is my point. We can actually integrate different concepts using anatomy or imaging or radiology. You can integrate all this. The ingredient that you need to integrate all this is hand gestures, and that's the point I need to stress. Okay, I want to play something, one of my favorite movies of mine is called Iron Man. You might have seen this, and this is a scene in which Iron Man is using a two-dimensional model of one of his Iron Man suits, and he's taking that into a virtual platform, and I want you to see how he manipulates that with his hands. And that is the exact way how we are planning to use air anatomy. So you can see how he's turning that gadget up and down, and he's turning that, he's manipulating them. He's designing an arm jack, a device that he can put around his arm. Everything is using that in a virtual environment like structure. He is now using a board, he is creating a virtual board, everything with hand gestures. Now this actor is Robert Downey Jr. and it is interesting to note that everything that you see here are graphics, but what he is doing is actually he is just playing in the air. Okay, so when we teach air anatomy, what we are actually doing is we are just playing like Robert Downey Jr. did in Iron Man. The only difference is that I am not Iron Man and I don't have graphics. Okay, but we are inspiring students to learn anatomy like this in the fun way, you know, in a ridiculous way, if you may, modern ways that the Zoomers or the Generation Z students will find more palatable. Okay, so this was the randomized control trial experiment that we did. We took a topic called extraocular muscle movements, and this was the way, ABC was the way how I created the illusion of the orbit. Okay, this is the medial wall of the orbit, the lateral wall of the orbit, that is this picture. Then the superior wall and the inferior wall using this picture, the base and the apex using this picture. Okay, then I showed how the eyeball will be located with the hands, the elevation and depression, the abduction and adduction, and the intorsion and extorsion. It's a complicated movement, but intorsion and extorsion becomes so simple when you start to use hand gestures. And that complicated movements of how superior rectus muscle direction is like this, and when the eye is abducted and when the superior rectus contracts, eye elevates, all those can be conveyed easily using hand gestures. And what we did in the randomized control trial experiment was that we use these hand gestures. These were the hand gestures that were used for teaching in the test group or the intervention group, and the other group we used, the control group, we used without hand gestures, and we compared their scores, and the scores were improved. You can see in this image that the basic recall and the applied knowledge were both increased. You can see in the intervention group and the control group here, both the scores were increased much more than for the control group. For the control group, the pretest scores were 0. For the intervention group also, the pretest score was 0. But the post-test scores for the control group, the basic recall was 85 median, and for the intervention it was 100. The applied knowledge, it was 42.9, intervention group it was 57.1. So it shows that intervention group, when it was taught using air anatomy, it showed very clear improvement. Now we also tested for cognitive loads. Okay, we measured intrinsic load, extrinsic load, and germane load. There are standard questionnaires for that, and when we measured that, we found out that the extrinsic load was reduced. This was the p-value, it was less than 0.05, and the germane load was also increased. That this is the p-value. Okay, comparing to the control and intervention group. Now we also took a rating of the students. In that also the stimulation and explication was also found to be improved when you compared with the control group. Now we also did a mental rotation test. The entire test was provided by Professor Michael Peters from the University of Guelph, and that has enabled us to measure that, and we found out that the moderate spatial ability students found out the air anatomy technique to be most useful. Other gesture-based studies are there in anatomy, and this is one called digit anatomy, where digits were used to understand various spatial aspects. Okay, but here the difference was that the digits itself were the structures. In my air anatomy part, actually we sort of mold structures in front of us instead of digits. Now digits is basically, here you can see the ascending aorta, and all the branches are the digits themselves. And the results are also pretty impressive, and this was done by O et al. From Korea. Now another important aspect is that actual drawing of images, it can be histological images or it can be osteology images, like in this figure. These are studies by Balamans et al. And Reid et al. They have shown that actually if you make students draw, it will help them to retain understanding better. Okay. Now another one is using clay modeling. This is also done by many colleagues of mine. Clay modeling either with colored clay or Play-Doh. This is also again done by O et al. And they took student surveys, and the students found it very useful, especially to understand cross-sectional anatomy. This is a wonderful method, low-tech methods. This is called the gut rotation model. This is Dr. Lapki Chan from China. He is using a tube, and in this tube he has created that mid-gut loop that is coming out of the from the body. It is herniating outwards. This is called the physiological umbilical herniation that you find in the embryonic period, and after that you can see how much the midgut is looping and how the transverse colon is now in front when you consider the retroped or the duodenum or the other structures that you see in the red part. Okay, so all these are some of the methods where gestures are used. These are all not pure gestures, but gestures are augmented using models. I want to stress that you need not use gestures alone, but you have to mix different methods ideally to create the best recipe that you need. This is another wonderful paper by Sherdew et al. They have shown that not only seeing gestures but also doing gestures will also increase motor memory and understanding. Okay, in this picture they have shown a radius and ulna initially remaining parallel, but then pronation is shown by crossing over. So students were asked to look at that image, and a few students were asked to do that image, do that maneuver along with that, and the students who did that fared well. Okay, so all these are various studies and methods that have been used earlier. Now if I just go to the conclusion, I would say words, when it goes to pictures or drawings, and it can be further extrapolated into models and to gestures. So drawings to pictures is the same as what gestures do to models. So if you ask students to draw images, which is very common to understand, to gain understanding, make students also to gesture, or at least show gesture based structures to students so that they can create mental models. Because in the end of learning anatomy, the most important aspect is the mental imagery that the student has. The mental image that the student can construct in his mind is the ultimate aim of an anatomy educator, okay, to impart spatial knowledge. So how much mental imagery you impart to the student, that is the measure, that is the determinant of the success of our part as an educator to provide spatial anatomy understanding for the student. So these are the points that I learned. Okay, remember the student with different intelligences. Okay, you have a visual learner, you have an oral learner, you have a reader and a kinesthetic. So you may be a visual learner. I am a visual learner. but my student may be a reader, so I have to remember that also. You need to make dishes that can be found at least somewhat palatable for every student. Okay. Don't limit your armamentarium. Okay, don't limit something to, I will use only this, I will use only diagrams, I will use only the chalk and board, I will use only traditional microscopes, I will not use anything else. Okay, that idea should not be there. You have to expand your own limits. Okay, you don't limit your armamentarium as a teacher. And as gestures is to models, drawing is to pictures. So make gestures as common as you do drawing. Remember the students with low spatial abilities. Low spatial ability students are not poor students, they just have lower spatial abilities, but you have to remember their lower spatial abilities, and you have to try your best to make it simpler. Okay. Now remember other things, that there are more ways to teach than the conventional ones that you already know. And for that, for understanding the newer ways to teach, you need to engage into educational research, and as I did an educational research just now, I think that some of the points that you need to know, that you need to listen to students, because they are the best data providers. They will guide you exactly what they need. They will tell you what is best for them to learn, like what I did. Then forming a vibrant research team is also extremely important. As you can see, my team is the reason for that paper, that research work to have been done, and all this that I could do to understand the role of gestures was all possible because of that team. And be open-minded, which is obviously very important for any research, not only in educational research. And last but not the least, always embrace technology. Technology will always advance us more. Never be timid or be technophobic, but always embrace technology. It will only help us to move forward. So with that note, I think I can conclude my talk. I thank all the delegates, all the organizers who invited me to this talk, and all the panelists and the moderator for hearing patiently. And I'm really eager to hear your comments. Thank you.
Thank you, sir, for your amazing talk. Now the session is open for panel discussion. You all are unmuted, sir. Ma'am.
So definitely it was a very, very lucid talk and very interesting. And Dr. George, I think the hand gestures have been in use for a long time, but the way you have rediscovered it and re-elaborated on it makes it very unique and interesting. And by your study, like now we have a basis also to include them scientifically in the teaching schedules and teaching times. You have, subjectively analyzed it and really defined it very well. Because I remember our teachers in our times, when we used to be so low on resources, there were hardly any educational aids there. And it may be true for the current situation in some places, in some medical colleges. So hand gestures are definitely, they're going to score, and they're going to help in imparting the different type of topics we are going to teach to students and all that. Very relevant topic. And I think students would be able to definitely focus better on the topic, focus better on the teacher also, because they tend to get distracted, Yeah. So hand gestures will help in focusing the student on the teacher as well. And of course, better cognition when it is added to the routine teaching methods. Yes. So, and as you have already said, some topics are more amenable to hand gestures, being explained. Yeah, yeah. And I think in the pandemic time now, it must have been very useful. And those who have been using it, not consciously using it, but just using it like that, goes a long way, because then you don't have any models or anything. You're taking class from home or from some place where you're not accessible to the models and different digital media. So very good point. And lots of teaching aids can be added to with this hand gestures. Good.
Yeah.
Congratulations.
Thank you, ma'am. Now I request Dr. Diya Singh, sir, to please say a few words.
Thank you, Dr. Doris, for your innovative talk. But I have certain comments regarding your talk. One comment is that there is no question or no dispute about the utility of hand in our body. That is all we all know, and during the evolution process, the hand was the body organ after brain, which was used. Still, you have shown some slides in which the mother was putting her hands to the child, and you have explained the importance of gesture. There is no doubt, but in my personal opinion, gesture is anything which you use when you are explaining a student as a teacher. Your topic, I was as a student that how I am still a learner of anatomy after my 50 years of teaching, and I fail to understand that how can I improvise my learning with the gesture, because the gesture problem is definitely not possible during my answering the examiner's question in the examination. Students these days are much more interested, and everyone of us will agree that the students have to face the examiners. And the examiner, if asked any question, if a student starts gesturing, I don't think the examiners will give any marks. Rather, that student fall away from the
point is right.
So gesture may be useful because we use, and one of your slides said that the gesture is the primary knowledge and the written words are secondary.
Yes,
I fail to understand your viewpoint because in that case, most of our anatomy knowledge goes by the written words only. We don't have any teacher who explains the anatomy by gesture only. We have to read the books, we have to read the world literature only by the written word. So I think written word is more primary. And in the beginning, when a learner comes as a first year medical student, we all teachers of anatomy try to explain him or her the terminology used, the so-called language of anatomy. And in the language of anatomy, if a student is made to understand what is the meaning of superior, inferior, medial, lateral, anterior, posterior, ventral, dorsal, all these terms which all of us explain to the student in the initial part of their course career. I think, Dr. Doris, you will agree that most of the anatomy we teach is imaginary. We can't use gestures. For example, we can't use gestures in telling the reproductive system. Can we use? We will be not using gestures. So gesture is an effort on the part of the teacher to explain the students, no doubt. Politicians, they use gestures in explaining the audience about their viewpoints. Fortunately, your state is the most literate state in the country. And as such, the students should be able to understand the written language much more easily as compared with certain remote medical colleges in our country, where the students are very rough and raw as far as the terminology of anatomy is concerned. So, as a student, I feel that when it is not possible, your method of explaining is more appropriate for the teaching part. Whereas your topic, I was interested to know that how the learning will improve with the gestures. How can we improve our learning? For learning, whatever teacher has taught by any method of teaching, I have to imagine it in my mind, and then I have to memorize it before I can appear in examination. So that is my viewpoint. Anyway, your talk was an initiative, and no dispute for the hands, and that is well written in the motor homunculus, that the hand has got a maximum area and representation in the cerebral cortex. So is the sensory, and not only the hand. The second point which I want to talk with you is that what is the difference between the hand gesture and the digit gesture? Are not digits the parts of the hand? So digit gesture, if you use only digits, it is a part of the hand. Hand comprises of the parts we all know. The digits are one of those parts in the hand. So that is my viewpoint. Anyway, I congratulate you once again for this
from
innovative
sir side. We
talk,
are unable to listen to sir. Now I request
to have some comments from you in this regard.
Can I reply? Yeah. Okay. Thank you, sir, for your comments. First of all, about the. Am I audible?
Yes.
Yeah. Okay.
Yes, you are audible.
Yeah. First of, should I share the screen, or otherwise I'll tell the point. What I meant by the point of primary and secondary knowledge is not for anatomy. It is for knowledge. It is not my presentation. It is from already research for that knowledge can be classified into primary and secondary. Primary knowledges are instinctively gained. We can learn anything from primary knowledge without any training. Like how a child learns to gesture. There is no proper instruction that is needed. Okay, that is a general educational theory. But anything that is of secondary knowledge needs an instruction. It needs it needs a conscious effort. It is not instinctively learned. That is the difference of biologically primary and biologically secondary knowledge. So the classification is that there are knowledges. The knowledge domain can be classified into biologically primary and biologically secondary. So gesture is considered as a primary knowledge by the point that all humans usually gesture, whether they, if you consider the all population in our country, everyone when they communicate spoken language, they will gesture. Okay, but if they ask to write, they won't be able to write. Many of the people won't be able to write unless they are instructed on how to learn the skill of writing. So that is a secondary knowledge. So that is why writing and reading is a secondary knowledge, but gesturing and spoken language is more of a primary knowledge. It is more instinctively learned by our evolutionary mechanisms.
Dr. Supriti, please move ahead.
Yes, sir.
Yes.
I request Dr. Teerthanker ma'am to say a few words.
Good afternoon, everyone. Thank you, Dr. Jain, for including me to be a panelist. And I'm honored to share the stage with Dr. D.R. Singh, who incidentally was my PG examiner when I cleared my PG. So, sir, it's really an honor to be a panelist with you. I would like to congratulate Dr. Doris on this presentation on air anatomy and use of hand gestures. Hand gestures, as you have already said, have been used for a long time, from children to dance performances to other speeches. And we also in anatomy should and have been using these hand gestures to make our relatively mundane subject more lively. So thank you for giving this input. And with this presentation, I think even the youngsters, the ones who are just young anatomists who have just joined and our profession, and they're becoming come into teaching line, they are going to definitely benefit from your talk. And I would like to say that the future of anatomist is in safe hands. Thank you.
Thank you, ma'am.
Thank you.
Dr. P. Vatsaswamy, ma'am, to say a few words.
I think you'll have to unmute, ma'am.
Yeah, ma'am is unmuted from our side.
She has.
Okay.
Let's try.
Ma'am, please try from your side. Okay, we'll come back to you, ma'am.
Dr. Gaurav, you please put your comments.
Okay, Doris,
Right.
I'll just try to summarize what you said and highlight the important aspects. One thing is, I believe you must be a very popular teacher because students like teacher with mannerisms. And if you have a particular style of teaching, then students do like that kind of teacher. I also don't agree with the Backstreet Boys when they say it's only words and words are all I have, because body gestures and body language is also important. Yeah. So you beautifully described the types of gestures which can be utilized for teaching. Indeed, teacher is an actor and the stage is the class. So, I remember when we were also taught, we were taught triangles with hands, fingers, this is this boundary, this is that boundary. And then even the intermuscular spaces were taught to us. And we used to remember them because they were taught to us using hand gestures. You gave beautiful examples and I really like them, and they can be incorporated because teachers should beg, borrow, and steal to make their classes more effective. I feel that. Your examples do make me think that what I understand from them is that one thing is to develop these gestures requires a lot of effort and practice, because you will think about your class and then develop these gestures and utilize them effectively in the class. So it stimulates and keeps the teacher working on the topic. And the students also, they may understand, they will definitely understand when you teach by gestures, but for them to replicate those gestures, is tough. So
Tough. It is tough.
It is tough, but some students, as you mentioned, are slow learners and some are fast learners. So this gives an opportunity to fast learners to become teachers at a very young age. That, okay, Dr. Doris told this, I can repeat it. Now you try to repeat it. So this is quite good. And I have learned a lot from your class today, from your topic today. And definitely you carry on with your work. And it was a very, very nice presentation. Thank you, Dr. Doris.
Dr. Supriti, please move ahead.
And now
We are running short of time.
Yes.
Move ahead.
Now to extend and project our confidence and appraise towards the guest speaker, moderator, and panelists of the session, we would like to present the certificate.
Madam Basala Swami ko unmute karo. Madam Basala Swami.
Yes, sir, we are trying.
क्या चलिए आप उसको फेलिसिटेट करिए पहले.
जी sir. To felicitate our guest speaker of the day, Dr. Doris, we would like to give the certificate of appreciation. Thank you, sir.
Well.
Certificate of appreciation for Dr. D.R. Singh, sir. Thank you, sir. Dr. Sneha Agarwal, ma'am. Thank you, ma'am. Dr. Hitant Vora, ma'am. Dr. P. Vatsaswamy, ma'am. And our moderator, Dr. Gaurav Agnihotri, sir. Thank you, everyone, for this wonderful session. Before moving forward, we have a video from our major sponsor, Elsewhere.